So our today's topic is Chalazion. Watch my video till the end so that you can understand. First of all, let's look at its definition. So Chalazion is basically chronic sterile inflammatory lipogranuloma of meibomian glands that is caused by retained sebaceous secretions. Now why these sebaceous secretions are retained in the meibomian glands, I'm going to discuss it with you in the later slides. For now, just keep in mind that Chalazion is more common in the upper eyelids than it is in the lower eyelids because meibomian glands are greater in number in the upper eyelids. They are about 30 to 40 in the upper eyelids, whereas 20 to 30 in the lower eyelid. Now let's discuss its pathogenesis. In this picture, you can see that on one side the meibomian glands are normal. It is not swollen at all, while on the other side you can see blocked meibomian glands, that is due to retained sebaceous secretions and the inflammatory reaction. Now let's see how it occurs. Obstruction of gland orifice. The gland orifice can get obstructed by any cause. It can be due to infection or any unknown cause. And when there is obstruction, it leads to retained lipid secretions in the glands. And when then there is accumulation of lipid secretion, it leads to chronic inflammatory reaction to start in around the acinus of the glands. And as a result, epithelioid and joint cells, plasma cells, lymphocytes gather around the acini of the glands. Now the chronic inflammation and retention of lipid secretions together leads to the swelling in the eyelid that causes Chalazion. In this picture, you can clearly see how Chalazion looks like. Now look at its clinical features. Painless swelling on the eyelid without the external inflammation signs. Number 2, redness and watering from the eyes. Nodule with or without inflammation. And mechanical pressure due to Chalazion causes blurring of vision due to astigmatism. It also causes ptosis, and it is also due to the mechanical pressure caused by Chalazion. Now let's look at its differential diagnosis. Sebaceous gland adenoma, sebaceous gland carcinoma, sarcoid granuloma, fungal infection, and foreign body granuloma. Now let's move on to the treatment. First of all, we have conservative treatment. Warm compresses 3 to 4 times a day. And we can also use topical steroid antibiotic combination drops. Now let's move on to the medical treatment. We can give corticosteroid injection, that is triamcinolone acetonide, that is injected through conjunctiva, and systemic antibiotics tetracycline, doxycycline. In conservative treatment, we can also give topical antibiotics, macrolides, erythromycin. In place of erythromycin, you can also give azithromycin, that is more advanced. Now surgical treatment, that is basically the most preferred treatment for Chalazion. In this, it is incised and contents are curated from the conjunctiva sites by vertical incision, and after the incision, antibiotic steroid drops are given 3 to 4 times daily for 1 week. In this picture, you can see post-op Chalazion after incision. Thank you guys, this was all about Chalazion. And now please don't forget to like, share and subscribe to my YouTube channel.